Hello, everyone, and welcome back to the Outcomes Rocket podcast. I'm so thrilled to have Ido Zamberg with us. He is a physician. Dr. Zamberg is a software engineer as well as a medical education leader. He's got a huge passion for transforming healthcare through innovation and technology. He serves as Chief Medical Officer at C8 Health and is driving AI-powered best practices, implementation solutions that really help improve patient outcomes and ultimately clinical decision-making. Dr. Zamberg, thanks so much for joining us today. It's a pleasure to have you on.
Thank you very much for inviting me.
Of course.
Glad to be here.
Yeah. So you're in Switzerland?
No, I'm in Montreal and soon moving to Boston.
All right. Globe-trotting there and finding your way to the U.S. soon. And Boston's a great place. A lot of health tech, a lot of opportunities there for a company like you guys.
Yeah, looking forward for the move. I think it's 10 degrees warmer than in Montreal, so it's also a big advantage.
That's a plus. That's a plus. Yeah, and is the family excited?
Yeah, we went there after a few years in Montreal. We went there in February, and while we had 2 meters of snow in our garden, suddenly we saw the floor in Boston. So that was quite an important trip.
I love it.
It's an easy way to convince the family. Yeah.
That's awesome, man. That's awesome. Well, it's going to be a good ride for you guys. Look, let's get into it, Dr. Zamberg. What got you into healthcare to begin with? And a lot of the physicians, I wouldn't say a lot, but a good chunk of physicians are now looking at industry. What made you make the shift into industry as well?
Yeah, so in healthcare in general, if I take it quite a few years back, I started as a computer, so I was a software engineer. I always thought I would be a software engineer, but I always had it in the back of my head that I wanted to study medicine. And then I used to do a lot of sports, and I broke my ACL, and then I had surgery. So that was my first interaction with a physician that had so much importance in my life. And I saw the impact that he had on me at that point. So I knew that this impact I didn't have as a computer scientist, as a software engineer, and I wanted to have this impact on people. So this kind of pushed me to my earlier dream of becoming a physician. So yeah, I did med school. I did my training in anesthesia and general internal medicine. And to be honest, I know what you're saying. And there's a lot of startups that are created by physicians that are kind of tired of the clinical work. Was not at all my case. I love clinical work. I love my years as a clinician, even though a lot of night shifts and a lot of long shifts. I don't want to say it was a mistake or it happened randomly, but basically I developed the software that we're doing now in C8 really to answer my need. So really a personal need. I came from around 14 years in the industry where my expertise was in large multinational companies, HP, Reverie, where I built systems for knowledge management and help people in the industry to find any information they need in seconds. And when I moved to healthcare, I saw how big the gap is and simply had this problem of finding all the institutional knowledge, the best practices that I needed in order to perform my job as a physician. And it was so complicated for me to find this information. So I ended up just developing something to help myself, which I deployed in my department and then in the entire health system where I work. And then it spread it out to other health systems. They challenged me at this point where there was something that was built and then thousands of clinicians were using it already, of saying, well, how can you promise us this will exist? This is great. Promise us this will exist for the next 20, 30, 50 years. And so they pushed me to think of how do we build a business out of it and how do we build something that is sustainable and that stays current for the next 100 or 200 years. So it's not because of the fact that I didn't want to be a clinician anymore. It's just I saw that maybe I can see 1 or 2 patients a day, but what I develop or what we develop in C8 really helps each clinician do their job much better, and then I'm touching actually and impacting thousands and thousands or maybe hundreds of thousands of patients through this software. So I kind of made the shift, but I still have kind of one day where I am working at the hospital.
Yeah, no, listen,
completely.
I think it's great. You want to do care, you want to provide care for the impact. You've got the software background, software democratizes and scales. And so now you're able to scale the care that could be delivered through this platform. So look, knowledge is power, but there's a lot of wrong knowledge out there, especially with LLMs and all these issues. Having fine-tuned knowledge at the point of care is critical, especially with the shortage of physicians, nurses, needing people to practice at the top of their license or upskilling people to fit gaps. Talk to us about the work that you guys do at C8 Health and how you're helping bridge some of those gaps and how you're different.
Yeah, so I'll start from the beginning in the sense that we talk a lot about digital health, but the clinician world is very analog, right? We have syringes and medicines. Ultimately, we need tools to take care of our patients. So any digital solution, if not done right or not done with the clinical mind, can be very disruptive in a wrong way to the clinician. We need to create digital solutions that are actually helping the clinician. And this is where it came because I created it to help myself. And what we do is a system for implementation of best practices. It means that we give hospitals tools to disseminate their know-how information, their best practice protocol guidelines, the way that they want that their clinician work so that they can control and standardize care, and also help them automate processes like quality interventions, onboarding of new staff. But ultimately for the clinician, staff members of a hospital have one unified platform where they can find answers to any type of formative questions that they might have during their day. From what is the clinical best practices for a specific procedure through what is my schedule tomorrow, who is working with me, how am I calling them, who is on call for a procedure, etc. And such as the way we are very different is really the quality of the data because so there's a lot of silos, a lot of different systems. So without our platform, a clinician we need to use around 10 different softwares, make a decision and have this information. What we do is not only that we take all this information from different systems and provide one place where they can find the answers, but we also make sure that this is the most accurate information. There's no duplicates, no conflicts, no similarities. And also we make the data itself actionable. So for example, you have a lot of companies that would collect quality data for hospitals so they could find problems. But what happens after you find a problem? How do you intervene at scale? So this is where we come, where we combine data from multiple sources and also tell the clinician how actually to be compliant with a specific best practice, how to be compliant with a specific metric, and help the departments or hospitals to intervene in an automatic and scalable manner based on people's actual individual performance. So if I'm very good at my job, I don't need to be annoyed by notifications or summaries. But if I'm underperforming this quality metric, that's where we can intervene and change people's behavior.
Thanks for that, Dr. Zamberg. Very clear. And so talk to us about use cases. Like, what is the best use case in your experience with the platform thus far? Where are you able to add the most value?
So we started by working with the department in the acute care, but in acute care space, specifically anesthesia. But since then, where we are very well integrated in most of academic centers, we're at around more than 100 hospitals today. But really the value grows as you grow to the system level, because then everyone is on the same page. So for a department level, the idea is that we provide a tool for them to manage their entire operations, whether it's quality, education, operations. Then we take it bigger to a service line. Then suddenly you have a system where multiple departments and multiple service lines be aligned on the same knowledge base, on the same know-how, and be able to work together and collaborate for a specific patient or for a specific procedure. So we can work at any level of the hospital, but definitely there's an incremental value as you grow to the health system level, and even to help coordinate care across their entire health systems and different sites.
Oh, that makes a lot of sense. From the point of care up to the system level, you're able to layer in, integrate, and allow people to get best practices going. As you reflect on a lot of the changes that are happening right now, we've got huge financial pressures on health systems right now with the big, beautiful bill. People on the fence on value-based care, what to do, what not to do, because right now margins are at risk. How can people think about your platform as a possible solution to that?
Yeah, so the whole idea of best practices are created because there's evidence that they improve patient care, they improve patient outcome. And in order to improve a patient outcome, there's different processes that needs to be done. So if I want to improve surgical site infections, for example, I need to make sure that I'm redosing antibiotics after a certain time during surgery, and that I'm checking specific patient glucose at a specific time. These are process metrics that are tracked and then where we can intervene. And then what's really nice about our system is that we can well, we can help you improve individual performance for each of these process metrics. And we can help you understand why people are not performing in a specific metric. And also can help you tie what each single % of increasing compliance to a specific metric equals in savings for you as the health system, and how it can relate to the incentives or avoidance of penalties that you might have from the payer side. So it's very granular to that level, with which can tie clients to savings incentives.
That's brilliant. Really appreciate that. A favorite question of mine here, Dr. Zamberg, is setbacks. Talk to us about maybe a setback that you've experienced and how that's made you better and helped you grow.
Yeah, I think in coming from the industries and being in healthcare, when you create a startup and you go for VCs, etc., they will always ask you. They will always try to make sure that the problem you're solving is big enough, right? And that someone will get fired if it's not solved. But the reality of healthcare is very different, right? The biggest problem in healthcare is staffing, right? Yet we are not solving it for the last 60 years. So I think that what I really learned is that it doesn't, even if the problem is big enough, it doesn't mean that if someone will not pay for it, it doesn't mean that the problem is not big enough. Really, what we learned is how to streamline the budgets and how to understand who is going to pay for it and why they're going to pay with it, and the fact that there's always a budget to use in order to solve a certain problem. It's just you need to find the right person and to work with the right champion within the healthcare system.
Yeah, it makes a lot of sense. I appreciate that. Yeah, there's the number one reason businesses fail is lack of product demand, and it's a huge issue. A lot of times it's lack of creativity, that you're not maybe going through the right channels to find budget from one department that could be applied to a particular solution, getting that group of stakeholders together. I love that you went there. I think it's a problem that a lot of companies face, and one that everyone could use a little creative juice in their process for. Look, Dr. Zamberg, this is awesome. I've really enjoyed our time together today. As we wrap up today, what closing thought would you leave our listeners with? And what's the best place they could follow you and connect with your company?
Yeah, so the best place to connect would be through LinkedIn. And maybe one closing thought would be that what I've said is that when we think healthcare, we need to think differently. So the fact that the problem is big enough doesn't necessarily tie into a specific budget. So I would encourage healthcare leaders from the hospital side to, instead of thinking of, well, we can do it ourselves and then spend many years of not necessarily solving a specific problem, even if it's big enough, to actually do design partner with startups, because these startups are comprised with people that dedicate their life and have very specific expertise in a specific domain. So not to be afraid to get third-party vendors and startups and work with them very closely, because these people, again, are the people that just spend 24 hours every day, 7 days a week to think on how to solve a big problem. And if the healthcare system does it, there's a bigger chance that we actually solve big problems, because these are the people that spend their life of understanding the problem and then creating a solution for that.
Amen to that. And a shout out to all of our healthcare startups and entrepreneurs out there. It's a grind, but innovation happens in these pockets, like Dr. Zamberg and his company, C8 Health, are innovating in getting the right knowledge to the right people at the point of care to make sure that you're having success on the outcomes perspective, and just as importantly, on the top and bottom lines of your business. Dr. Zamberg, I want to thank you very much for joining us. This has been a really great opportunity to learn more about you and learn more about C8 Health. We'll make sure that we include all of the ways to get in touch with you in the show notes. So thank you very much for joining us.
Thank you so much for inviting me.